Welcome in, ladies and gentlemen, to our first ever episode of our brand spanking new podcast, MJR and Friends. That's MJR right here. It's Michael Rossi. I am here debuting this new podcast, a new platform for local leaders, business owners, charity runners, healthcare workers, dog walkers, anyone that wants to come on and share a word, share their thoughts on things, share their businesses. This is what MJR and Friends is about, and I am very excited to have our special guest on. She was part of our Studs podcast a couple months ago. I think, what is it, 3 months ago? 2 months ago?
I think so. So much has changed.
It has changed since that first topic. But today we have, debuting on our first episode, we have Jennifer Ebbitt, not Everett, Jennifer Ebbitt, care navigator for Hope Health, amazing mom, and then Holland Oates fanatic. Jennifer, how are you today?
I'm great. How are you?
I'm feeling it. I'm good.
Good.
I'm good. I'm excited to learn today. I'm excited for all the listeners to learn today. Before we continue, you can check us out. Our brand new name, the MJR Podcast Family. We have the MJR and Friends Podcast, which will be debuting soon. We have the Dad and Bud Podcast. There's already a couple episodes that have been published. That's with my buddy Will and his son. You can check that out, dabd.a.b.podcast. And then we have Meet Up with Mila, which is actually debuting on Saturday. That's debuting tomorrow morning. That's with my great friend Melissa Hooks. She's going to be sharing her thoughts on things. We got a lot of podcasts and hopefully more to add. And don't forget, we still got the GOAT, the Studs Podcast. That's still coming out. We'll be doing all of our sports and fun takes with that. They can check us out, MJR Podcast Family, on Facebook and YouTube, all the individual channels on themselves, Spotify, all that stuff. But let's get into it. Jennifer, thank you for coming on today and sharing your word. And
thanks for having me. All right. Very good.
All right. So the first thing I saw that you wanted to speak about is, and I think it's something dire, is the COVID-19, the new strain.
Yes.
And obviously that definitely puts fear in a lot of people. And I'd love to hear your thoughts and maybe research that you've done on that and things you'd like to share about that.
Yeah. So, I mean, we all know that the flu virus comes around the globe every year, changes every year. That's why the flu vaccine is different every year. It's never the same twice, essentially. Viruses need to adapt to survive. And this virus isn't any different. So I think people are really scared of what it looks like coming around, hearing that it's a new thing or a different thing. But I think it's expected. And I do see some pretty current research, I want to say, on the Pfizer vaccine that says that it may be helpful against this new strain because it's not going to change by leaps and bounds. It's going to change a little bit to try to be unnoticed in the bodies it infects. So the vaccines that are going out there, getting in people's arms, it should probably still be protective, which is good to know. Yeah, it sounds scarier maybe than it is. And I think, the media gives us the information that sells papers. Like, we have to remember that it can be a little scarier in the media than it might be in real life until proven otherwise. So I don't think it's anything we need to be terrified of. I think it's something to be mindful of and know that this bug is still new and it's adapting and it's trying to survive just like we are.
And you bring up a good point too, and I pulled it up, but you already got to it. The article about the Pfizer vaccine supposedly appears to work against mutation, which I think is great news.
Yeah,
I would take that definitely as great news. I think in general, I think the media does a great job of definitely bring it up. What happened Wednesday? Was it Wednesday or Wednesday was horrific.
Yeah, it's a blur. The whole week is a blur.
Yeah. It was like, that was one of those things where it's like, I didn't feel like doing anything.
Yeah.
Like you have like the Boston Marathon, like that day I didn't feel like doing anything. Or when you have just like a big event like that, it's like, what is going on?
Yeah.
What is going on? And the media, I think, always portrays things in a worse light because it draws people and people are attracted to drama. But my question to you is, how long do you see this new strain coming in and taking over, or do you think it's actually going to be a little, with this vaccine, do you think it's going to be as bad?
I don't I don't know. I don't think it'll be as bad. I think that we are, when they created that vaccine, like there's more to immunology and virology than I'll ever forget, let alone know and understand. Um, it's built into the science. So vaccines, it's built into the science. It's a virus is a dynamic thing and it's good at changing itself to survive. So it's built into the science of these vaccines. And if we get good herd immunity and we get good numbers of people to get vaccinated and we continue our social distancing, we continue our masking, and we do those things to stay, on the right side of this, then I don't think it's going to be that bad all of a sudden, come back around and it's like COVID 2.0. I don't see that being the case. I mean, I hate to tempt karma, but I see it being built into the science that's there to protect us from what we already know.
Fears. What are some fears you're hearing about the vaccine?
There's the
From
normal, the normal vaccine fears, I think, are like anything else. People don't want to get the flu shot because, well, it's going to give me the flu, or it's going to make me feel sick, or my arm is going to hurt, and I have to miss the gym, or whatever. I hear a lot of those very normal, rational fears of, hey, it's a new vaccine. It was created pretty quick, and I don't know if I trust it to put in my body. Which, as a side note, if you've ever eaten a McRib, you can get the vaccine. It's by far safer than most of the food we put in our body in this country. So,
the McRib's got the vitamins.
oh yeah,
It's got the
I'm
vitamins,
sure.
right?
Yeah. You should be 1,000 times more worried about the fast food that goes into your body than a vaccine. So it's been tested. Has it been tested as much as something that has 10 years worth of research? No, we don't have time for that. So people have those normal, rational fears of, well, I don't want to get sick from it. But the bigger fears lead more into the mental health status of the 24-hour news cycle, social media stuff, which is there's people who don't want to get the vaccine because there's microchips in it. And there's nanoparticles that will track my internet searches. I mean, these are real fringe concerns that people take as gospel, which is insane to me. But there are people out there that really are afraid of this vaccine for some sort of governmental tracking device. Like this has all been some kind of joke, and it's bizarre. The fears that I've heard people come up with, bizarre. Don't even have more words for it than that. Just craziness.
For sure. Do you feel that there is one that's better than the other?
They both have their own kind of perks as far as the two pharmaceutical companies. So the Moderna they thought was a little bit more effective, I believe, in the beginning of when they were both rolled out, and thought that the Moderna was more likely to stop you from being able to spread COVID, that it would sort of come into your body and die there, as opposed to just protect you, but you could still spread it. And now they're saying the Pfizer vaccine has more potentially coverage against any mutation. So I think they both are, if you can get one or the other, I wouldn't wait for the other one to come available. If you have access to getting one or the other, get it.
I've obviously had my doubts, of course. I think everyone has. I don't think there's one person that can sit there and say, I'm no fear of doing it. Like I'm sure you have it down your head, like, what's going to happen to me 3 months from now?
Right.
Am I going to mutate?
Right. And are those fears? I mean, it's normal. And the problem with it is we should all have that fear with everything we do to our body, but we don't. We don't take heart disease into question because we can just eat, a terrible diet and smoke and drink and, have all these things that are bad because of it. And not think that that's the same as questioning a vaccine to question your diet. It's just easier to say no to a one-time shot than it is to say no to a whole lifestyle that you don't want to give up. So I think it should start the conversation of really paying attention to what we do to our bodies and what we put into our bodies. But I think the conversation kind of ends with a lot of people of, I'm nervous about this particular vaccine and not want to get it. And sure, if something happens 3 months from now and it's caused from the vaccine, I'll kind of, I'll be upset, obviously, if something goes wrong. But we outweigh benefit to risk, and that's a big question in healthcare with everything, is risk and benefit. So you outweigh the risk of not getting the vaccine versus the benefit of getting it. I'm getting it 10 times out of 10.
You already have in 9 minutes, 10 minutes, the quote of the whole podcast, and that is, don't be afraid of the vaccine. It's something I kind of switched it around, but don't be afraid of the vaccine. Be afraid of the food and things you put into your body.
Yeah.
I think that's the quote already. Like, we're done. Bye. All right. And we're ending
See you
this
later.
now. That's
See you
it.
later.
I think that is a great quote. And it brings up this next point. I've heard a lot of people say, scientists and even other podcasters and biohackers, and this is the time, COVID should be the time where you really reflect and say, what do I need to do to my body to change it? What other ways can I become healthier? And from a personal perspective, have you seen people maybe around you, or even patients or people that they're like, this changed my life. Like, I'm losing weight faster and I'm doing things differently. Like, have you seen any people kind of taking this more seriously, or are they still continuing their same habits?
I can't say that I've seen anything significant in that way. Unfortunately, I wish, that people would start to use this as a jumping off point of, hey, they need to think about what I do to my body. I need to think about the condition I'm in. And the people that were most at risk were the ones that had poor health to begin with, and if this wasn't the motivator to turn around and say, I should probably do something about that, I don't know what is. Our diet and lifestyle in this country is going to kill us just as much as COVID, and there's not enough change, I think.
Would you say more?
Over a long span of time, our lifestyle kills us more than anything else. Absolutely.
Even
our levels, COVID's working faster.
Yeah.
COVID's taking advantage of our lifestyle. That's taking advantage of a body that can't fight back because it's not healthy. So that's in essence why, when you have a lot of risk factors, by the numbers, you get sicker from this and you are more likely to die from this. I mean, we have those outliers of, sports figures and athletes that get sick and never recover fully because of the damage the disease has caused. This is not to say that it unilaterally only affects you if you're in poor health, but your outcomes are much worse if you're in poor health. But it's easier to say, no, I don't trust the vaccine, I'm not putting it in my body, on a one-time offer, than it is to every single day get up and drink water and exercise and limit the saturated fats and the junk that we eat. That's a lifestyle, and it's much harder to take care of our body long term than it is to make one snap decision to sound like you're refusing it because of you're fearful of the side effect or whatever. We need to be more mindful of our health, because look, the number one killers in the country: cancers, heart disease, diabetes, strokes. Those are predominantly caused by lifestyle, whether it's stress, diet, drinking, drugs, smoking. Lifestyle accounts for a whole lot of the reasons that we all die, really.
And again, you just keep bringing up the point of lifestyle, and I really haven't, until you said that. That's been one of the best. Honestly, that's been one of the best quotes I've heard. Just, you're afraid of taking the vaccine, which, again, I'll admit I've had my doubts about taking it. I'm not going to sit here and lie. Right. Will I take it though? Yes, but I've had my doubts. But when you say it like that, when you say what you put in your body, when you eat a McRib, when you eat a piece of pizza from Cumberland Farms at 2 a.m. on a Saturday night after you've been partying, because that's what I do.
Right.
That is far worse than probably anything that this vaccine is putting into your body.
Right.
And it's just a different perspective, and I think a lot of people need, include probably myself. I mean, everyone. I think you need a different perspective on what is happening.
Right. And I think anytime you take a medication or you accept any medical procedure, drug, anything, we should give it pause. These things aren't little. I mean, a vaccine, it's a simple little thing. It's a little needle poke. But it's, it's telling your immune system what to do. I mean, it's something you need to consider, just like medication. Anything you take for medication, like, you should understand it. You should have a healthy respect for it. Can't just be going rogue on stuff like that. It should be the start of a thought process, and the start of a conversation with ourselves when we really feel strongly yes or no to take a vaccine or to take a medication, to question all the things we do to our body, you know?
Absolutely, and I wanted to bring up something that I saw, and I can't find the article. It was I forget what channel it was on too, but they were talking about the Spanish flu
Yeah.
and then the 1918 pandemic, and I remember they saying that how it came to New York, and they had a vaccine so fast,
Hmm.
and people took it, and they saw it. Now I could be wrong. There could be some mixed up facts there, but they just talked about how fast they had lines
Hmm.
around 7, 8 blocks in New York City, and they got more vaccines done in a weekend than probably like it. And the point is, why isn't that happening right now? Why are like, again? I watched the news the other day and I saw some places are shutting down at 5 o'clock.
Yeah.
No more, no vac. Why aren't they open all day, every day, with all different shifts? First shift, second shift, third shift. Why isn't this happening? Is it logistical? Is it
I
can it
think
happen or not?
I think a big piece of it right now is you need healthcare workers to administer these vaccines, and you need first responders to give these vaccines, and they are in pitifully short supply right now. And you think about the medical supplies it takes to administer one vaccine. So you sit down, that table, that chair has to be sanitized. There's alcohol pads, there's syringes, there's rubber gloves, there's face masks that has to get all thrown away or sanitized and reused for the next person. So there's a cost, a human cost, to have someone in that chair to vaccinate you, as well as there's, healthcare bits and pieces of things we need to have there to make it happen. And those things are still in short supply, especially people. People are in very short supply. I don't think there's one area of this country that's not touched by short-staffed healthcare. It's scary.
And that brings up the next topic that we want to go into. But before we do that, your honest answer: how long do you see this lasting for? Like, do you see an end in sight where, at least, I mean, it'll never end. Obviously, it's going to be the new flu. It's going to
Right.
be
And
a worse version. It's never going to go away.
this is
But
going to be on, your children's childhood immunization records. You're going to have your measles, mumps, rubella. You're going to have
yeah,
COVID.
COVID.
Yeah, it's not just going to go away. It has to get woven into the fabric of our lives. Not to sound like a cotton commercial from the 90s, but it has to be woven into what we live with every day.
When do you see a maskless society?
Maybe within 2 years. It depends on us. It depends on the choices we make. If we're going to continually have voices that are telling us it's a hoax, it's not real, it's brainwashing to wear a mask. If we're going to go there, we're never going to get where we need to be. We need to hit, I think the general census is 70% or more of the population has to be vaccinated fully. So 2 vaccines a month or so apart, to start the process of having a herd immunity sufficient enough to go back to a maskless society. I would say 2 years, because again, human behavior. This is human behavior. That's what needs to change to make a difference in any of this. And it's probably less likely than the most advanced science to fix the problem, when it could be fixed very, very much more easily by a change in human behavior. But we see how well that's going most of the time. So
Yes,
yeah.
yes. Let's get into healthcare and the burden that is putting on frontline workers. And I honestly, and you see it, it's brutal.
Mm-hmm.
Just as a transporter, and I can only imagine the nurses and doctors what they're going through. But just wearing a respirator on my mask, on my face,
Mm-hmm.
for more than 5 minutes, I'm like, well, I can't do this.
Yeah.
I can't breathe.
Yeah.
I can't do this. And to see the agony and to see what these nurses and these doctors are, especially the nurses. I really want to shout out to everyone in the hospital, especially the nurses, and what I see them do every single day. And it's like, I have no blame for someone if they looked at you and said, "I'm done.
Yeah.
I'm done. I've done my duty. Like, I want to, like, go home and I
Right.
want to start my own business. Like this is
I
not
want to do anything else.
what I signed on for." And you bring up a good point. People are frontline workers are getting called heroes from a society that still thinks this pandemic is fake.
Right. And
I would like you to elaborate on that.
Yeah, I'm not going to make the one-to-one comparison that what healthcare workers are dealing with right now are the same as military, but I catch the flavor of what it must have been like to fight and die in, say, the Vietnam War, knowing that everybody at home disagreed with it. So you're laying your life on the line and you're giving it everything you have and more, to then turn around and have someone think that the fight you're fighting is baloney. You know, it's you can call all the healthcare workers heroes. At the end of the day, many of us are just, we want to help. We got into healthcare to help. We got in healthcare to make suffering less. But we're also grateful to still have a job that pays the bills. You know, a lot of people can't say that. Healthcare, we sure can. But calling us heroes and then turning around and still having people stand on whatever pulpit they have to stand on to say this isn't real, when we're the ones who see it day in and day out wreak havoc on so many more levels than just the patients that have COVID. The mental toll is exhausting. It blows my mind to know that there's this dual school of thought of, you guys are amazing, you're putting your life on the line, and these healthcare workers, the CNAs, the housekeeping, the transporters, the people who make stuff happen, we're all out there and we're all putting things at risk and we're working our tails off. And you have people saying, God, thank you so much. You know, that must be really scary. Good for you for sticking it out. And then on the other side of things, you have people going, nah, it's all crap. My friend got hit by a train and they said he died from COVID. The emotional toll is like, I'm sure there's a better psychiatric professional out there that can give you better insight than I can, but it's just mind-numbing to exist in both of those places at once.
This could be off the record if you wanted to, but you bring up a good point, because I've heard a lot of people mention this. Is there any truth, or do you believe that there's any truth? And like I said, if you don't want it on here, we edit it up. If there's any truth to hospitals claiming false COVID cases for money?
The concept of that being possible, if someone's figured it out, I don't know how. I mean, you're putting your entire life on the line to say that you're intentionally falsifying any medical record. I mean, falsifying medical information that's a fast way to jail and a fast way to lose your license. You know, hospitals are hemorrhaging money, which seems crazy, right? You know, you're sick. A sick person's a patient in a hospital. That's a customer. Not all these people are insured, and not all these people are paying for their hospitalization. And if your insurance company says you're only sick enough, to their reviewers, you're only sick enough to get 30 days in the hospital and you need to be there for 90, that hospital's not getting paid for you. I mean, hospitals are hemorrhaging money. And you think, well, nurses get paid well, doctors surely get paid well, and you're working overtime. You know, the hospital's got to be raking it in, and they're not. You know, there's nothing to be gained by falsifying a medical record to say those things. What people don't understand is when you die and you have a death certificate, the most likely cause of death is listed on your death certificate, but so are all of your other active conditions. So COVID might be listed on your death certificate if you've tested positive for COVID. If you died because you had a heart attack, but while you were being worked up for your heart attack, you were also diagnosed with COVID, it's going on that documentation. So it's not falsified for any gain. It's completeness of a medical record. That kind of thing. But it's easy for people to say, well, I know that this happens because it's easy to just write, something down, but they don't realize the implications and the layers of, checking and double checking that these things are accurate.
I think a lot of people need to hear that.
Yeah. Yeah. And we don't know what we don't know. I know these things because that's my profession. That's what I do. That's what I see. There's a lot of stuff about, construction that I can make an assessment on or a judgment call on, but I might not know 9/10 of what that actually is. So it's easy for me to say, well, I know this happens because I think it makes sense that could happen. But it just doesn't.
Let me move on to this. It was something that I thought of before we came on. How are you, and how is anyone who's working with the final goodbyes and people who are about to die and need to do? How are you dealing with the families that can't go in and see their patients, and they only get to see them 90% of the time when they're already passed?
Right. Or they'll get 15 to 30 minutes to come into the hospital. And I know you must see it too over where you are, because it's
devastating.
It is absolutely awful. So we're, I guess you can call it lucky in the sense that if you are going to be granted visit for your family member in the hospital, you get it if they're dying. You do get some time to come in and see them. But I mean, we've gone from times during this pandemic where there was, sorry, you cannot come in here. You cannot see your loved one. To other times where it's been a little bit more open. And now we're back to very short time, no open visitation. It's heartbreaking, and a lot of these families haven't seen their loved ones because of their own, isolation or quarantine, or they're coming in from a nursing home. And it's, to tell somebody you can't see your family member as they're dying. I know as someone who lost their mom in the hospital, we camped out at her bedside all night. I can't imagine being told you can't come here. You can't see her. It's absolutely, it's like nothing I ever anticipated seeing doing this kind of work.
And what's like I'm sure you have people come up to you and say, how do I get through this?
Yeah.
How do I get through not being able to see my family, my cousin, my best friend? How do you cope them through it, or
so
is there even a way to?
I don't know if there's any magic, words or any magic combination of things to do to kind of get through this. But I mean, our organization's been really amazing. We have a fantastic team of support professionals whose only, mission a lot of times is putting things together for, grief support and caregiver support and health caregiver support. We have different virtual support groups and opportunities to reach out and say, hey, I'm not okay. So those are the more formal things. But a lot of times I try to tell families that, if you can get one person in to visit, even for a short time, put it on a Skype, put it on a FaceTime call. Try to get as many people to see them, live and in color as you can. A lot of the staff, there's been some really amazing stories of the staff using personal phones, if they have to just do a video call, just to say, see, mom's okay, we're having a great day, just trying to be as human as possible and getting these guys to see their families. But it's not easy. I mean, I've had families hysterical from the car, that they couldn't come in, they couldn't see their loved ones. I don't know. I don't think there's any good words, but I know it weighs as heavy on the caregiver, the nurses, the staff, as it does on the families to be able to say, no, you can't come here, because that decision's bigger than us, unfortunately.
So when you say, to move on, the collateral suffering of the pandemic, what do you mean by that?
So especially like just like we're talking about right now, these families that can't come in and see their loved ones, that's not because their loved one is directly affected by COVID. It's not because they themselves are affected by COVID. It's the restrictions in place to control this pandemic that is raging still out of control, even after all we know and all we've done, still out there. So it's not that, COVID directly is affecting these families. It's not, it's this sort of collateral suffering of, because of COVID, I can't see my loved one in the hospital. Because of COVID, I can't spend a holiday normally with my loved ones. I can't feel comfortable going in and getting timely treatment. I have seen patients and families that were so afraid to go into the hospital to have a nagging symptom checked that by the time they did come to find out it was cancer and it was everywhere. Those kinds of things, that just the presence of a pandemic condition has had to change so much around us and affect so much around us.
My the final point I would like to bring up is, and I know we touched on it before, but I know you wanted to bring up the mental health of the country right now. And again, with the events that transpired on Wednesday, I don't think it's very good.
It is not very good.
And I say that jokingly, but it's serious. What would you like to say about that?
So I think very much of what we're faced with right now comes down to the internet was supposed to be like humanity's greatest creation, right? Unlimited access to information, unlimited connections to other people and other cultures. And we really did not use it the way it was intended. We have been able to take these very outlying fringe conspiracy theories, sort of edge of reality, sci-fi thoughts, stick them on a meme and have people take them as gospel. It's not okay. And it's easier to digest a funny little picture, of Keanu Reeves with a little blip on it that gives you information that speaks to your side of how you want to believe something happened. It's easy. It's far harder to find reputable sources and fact. And the fact that fact has been able to become optional, and math seems to be optional, and it doesn't do well for the psyche. I mean, we all know if we turn off the news, we're going to feel a whole lot better because the news is just crazy and we're going to fall right down that rabbit hole with it. But it's always there and it's intermixed. The bad things that are going on in the world are our, like, they're always there. There's a 24-hour news cycle. There's 1,000 social media outlets. It's always in our face, and it alone, that constant barrage of information alone is enough to make us all a little wacky. But then you start to see these common threads of things that you're like, wow, that's happening because that guy on Facebook told me it's happening. And now you take it on as gospel and everything is a conspiracy. I mean, it's very paranoid behavior to think that everyone is out to get you and everything's a conspiracy. But now we kind of live in a world where people take that as truth and question the people who went to school for more years than I've been alive, and I'm not young, to master their craft of science and math, and it can be undone with a meme that some dude made in his basement. So it's not good. And it goes back to that same, we're watching people die. Healthcare is watching people die hand over fist. And the internet tells us that those numbers are fake. The pandemic is a mind control device and the vaccine has microchips in it. It weighs on a person to see it happen in real life and then be told it's not happening. Like, it's like living in the Matrix. It's not good for anybody's mental health. But, the effects of this week kind of show that. Maybe there is substance to what a lot of those people believed was happening in the government, and maybe there's not. But to believe something so passionately, to do what was done, blows my mind. It blows my mind.
Same. Would you? It definitely is. And before we I got a little something fun, like I
Oh
always
no.
do.
Oh
But
no.
before we go into that, anything else? Any final thoughts you'd like to cover? Any final points?
No, I just, I'm thinking of all the families out there that are affected by everything that's going on and doing what they can to take their loved ones home to care for them instead of seeing them go to a nursing home or be trapped in the hospital. This is not easy. If there's anything we can all learn from this is that it's okay to have difference of opinion. It's okay to not feel like you're being told the total and utter truth by the world around us. But when we stand so firmly on one side or the other, it blocks the view of the person on the other side. We have to be able to bend. We have to be able to see what's going on from more than the perspective that we personally understand. We have the ability to be worldly. We have the internet. You can learn anything you want. We just have to learn the right things and be able to understand where other people are coming from. We have to accept science. We have to accept fact. We have to accept math, because those are things that aren't optional. But we also have to understand the human piece of this and not be so stringent with our side of things. Just be human and see each other's point and understand their life has made them feel and think and understand things a certain way. Just take everything with a grain of salt. Life's supposed to be fun. We're all taking everything way too seriously.
It's been a joy learning from you.
Hey, thanks. I do what I
Second time in a
can.
row. Every time I'm learning something new.
Good.
And I hope there's going to be another time.
I do too.
I do hope so. But let's get a little fun, because
Okay.
I'm a fun guy and I can't be serious for too long, as you can see. So,
Yeah, I know.
It is time to play Name That Tune, Part 2.
Oh, no.
Yes, and of course we got to do it. We got to do it. I've actually found some new Hall & Notes songs that I've actually come to like. In
New.
recent, some
Okay.
new, no, not new, like
No,
just
not
ones
new,
from
new,
back then, just like some newer ones. And I'm like, when Jennifer's coming back on, we got to do this. So last time we played trivia. This time we're playing Name That Tune.
I'm terrible at this, right?
Yes, that's why I'm doing it. So
Okay, figured.
So we're gonna play Name That Tune, and this is a part of the MJR Friends tradition. So whoever comes on will have to do something, sort of name that type of thing. So
Okay. All
anyway, all right. So, and like I said, these are all Hall & Notes songs, so it really cuts it down for you.
right.
All right.
All right.
We're gonna see how you do. And this trivia comes from funtrivia.com/playquiz/quiz. That's the lyric, and it's from funtrivia.com. So
Okay.
shout out to funtrivia.com. It says the average score for this quiz is 60%, and the
Okay.
difficulty is tough. So,
Okay.
are you ready for this?
I'm ready for this. Let's do it.
Let's do it. All right. Which song contains the following line? You tell me your best friend's world seems beautiful.
I'm going to go with...
yeah, all right. Continue.
yeah, I don't know.
I can give you the 4 choices. Out of touch, some things are better left unsaid, everything your heart desires, or possession, obsession.
I'm going to go with the second one.
Okay, I guess it doesn't tell me the answer, so we got to wait till the end. What's up?
Okay. No, I was just saying I'm even worse at this when it's spoken words and lyrics.
Well, I'll try to sing it if
Okay.
I know what it is, because I don't even know what that was. All right.
Yeah.
Next one. Broken ice still melts in the sun. Is that Out of Touch, You Make My Dreams, Change of Season, or Say It Isn't So?
That one's Out of Touch.
Oh, boy. Okay.
That was a Liam favorite when he was little.
Yeah, it is. Can you play Hall & Notes, Mr. Rossi?
You're like, yeah, that's
yeah,
a
sure.
6-year-old's request. Yeah.
Yeah, sure, I'll do it. If you're not an easy mark, it's a shot in the dark that hits the heart. Did it in a minute, You Make My Dreams, Private Eyes, or Rich Girl?
I can't place that one. I'm gonna go with Rich Girl.
Okay. Think I'll spend eternity in the city. Let the carbon and monoxide choke my thoughts away. I know this one. Is it Rich Girl, Wait for Me, Possession, Obsession, and She's Gone?
I don't know that one.
Oh, such a good one, too.
Oh, the last one.
This song was covered, by the way, by a local band, Tavares.
Oh.
They're amazing. Yeah, they were back in the 70s and 80s. They actually did it better than Hall & Oates. But anyway, if you feel like leaving, you know you can go. Is that She's Gone, Sarah Smile, Wait for Me, or Did It a Minute?
The first one.
Okay. All right.
I think that's probably wrong.
Probably. All right, we got 4 more.
Okay.
The boys are busy in the mirrors trying to imitate their heroes. Is that Did It in a Minute, Some Things Are Better Left Unsaid, Adult Education, or Possession Obsession?
Adult Education.
Okay. All right, 3 more. She had sultry eyes. She made it perfectly plain that she was his for a price. Adult Education, Family Man, Man-Eater, or Possession Obsession?
Is that Man-Eater?
These people really like Possession Obsession.
No kidding.
That's very tough to say. Holy
I know.
Lord.
I was hoping more for Sarah Smile options.
I know, huh?
It's all right.
So you said Man-Eater?
Yeah, I think so.
All right. Easy, ready, willing, overtime. Where does it stop? Where do you dare me to draw the line? Come on.
Told you I'm terrible at this, and it's Friday. I'm brain dead.
Possession Obsession.
Options.
I can't go for that. No can do. Adult Education or Man-Eater? Easy, ready, willing. No can do. Boom.
I can't go for that?
Boom, 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 boom.
This is not translating well for me.
I helped you a lot with that.
Yeah, you
All
did.
right. Next one. I can call you, got your number, share my life with you 1,000 miles away. Possession Obsession, Method of Modern Love, Some Things Are Better Left Unsaid, or Family Man?
I'm going to go with Possession Obsession because they
let's
really
give that a
wanted
chance.
me to choose that.
Yes.
They really pushed that one on me.
And last one. On a night when bad dreams become a screamer, when they're messing with the dreamer, I can laugh in the face. Is that Your Imagination, Dream Time, Their Favorite, Possession Obsession, or You Make My Dreams?
Dream Time? Was that not?
Oh. On the night when bad dreams become a screamer, when they're messing with the dreamer, I can laugh it in the face. Doo-doo.
Yes.
You make... Oh, I just gave it away.
Yeah, that. What were my options again? I can't think of the name of the song.
Right. You Make My Dreams. Come on.
Yes, thank you. I knew Dream was in it.
All right.
Other words around it.
So the average is 60%. Let's see what Jen got. All right. First one was wrong. You said Some Things Are Better Left Unsaid. It was Everything Your Heart Desires.
Okay.
All right. Next one. Broken Ice Still Melts in the Sun. That correct answer was Out of Touch, and you got that correct. Next one. If You're Not an Easy Mark, It's a Shot in the Dark that Hits the Heart. Your answer was Rich Girl. That was incorrect. That was Did It in a Minute. I won't go through everyone, but you got number 4 right. She's Gone. I kind of helped you out with that.
Yeah.
You got number 6 right. Adult Education. That was very good. You got number 8 right because I helped you out with that.
You did.
Now, one of these answers, by the way, was Possession Obsession.
I feel like I've been duped.
Yes.
When it's the option every time.
Yes. And your score. The average is 60%, just under a 50%.
All right. I can take a 50.
Would you like me to enter your email to send you the results?
I'm good, thank you. That one can remain anonymous.
It's been fun.
It has.
Jen, thank you very much for coming on. I know you'll be back. I hope you'll be back. You will be back.
I will be back.
And I'd like to do an alien podcast with you at some point.
Okay. All right. We could do an alien podcast. Seems to be a lot of tinfoil hats out there these days. So
I'm ready to do it. I got some articles that could really show that there are aliens coming for us.
Okay. I was going to say I'd have to beg them to reconsider.
If you're watching this, greetings.
They're like Canadians. They would like to go, but they don't want to take me.
Yes, no, I want to go. But anyway, Jennifer Ebbitt, caregiver for Hope Healthcare, thank you very much for coming on. You can check out this interview and this session on the MJR and Friends podcast channel. That's going to be on YouTube. You can check out the links on Facebook at the MJR podcast family. It's been awesome. Please check us out.
Yes, it has.
Anchor.fm platform. Check out our other great podcast as well. And we will talk to you guys soon.
Thank you.
It's a big bird.